Thank you and good evening and welcome to the June 4th Human Resources Committee for the School District of Waukesha. And I'd like to call the meeting to order. My name is Steve Edlund, and I'd allow my fellow committee members to introduce themselves.
And I'm Pat Madden.
And we also have Suzanne Pulaski, who is our recording secretary, and Chris Hedstrom, who is our HR director. Pardon? Oh, and I'm sorry, guest Lori Clifton, who will be here tonight, assisting us with some of our agenda items. First item is a verification of the meeting posting. Chris, has the meeting been properly posted?
Yes, it has.
Thank you. And our second item is opportunity for citizens to speak or correspondences. Do we have anybody who would like to address the board tonight? Seeing as how there's nobody, I'm going to check that item off. And information items, we do not have any information items, so we'll go right into our action items. The first item for consideration is resignation and retirements, and recommendation from, there is a recommendation from the HR department, so I will have them take us through the resignation, or excuse me, the resignation and retirements.
And there is an addendum at your desk.
Okay, any comments from administration on the recommendation?
I have no comments.
Okay,
Second.
okay, I have a motion to approve the resignation and retirements as presented by the administration. Any further discussion? No discussion? All in favor say aye.
Aye.
Aye. Opposed? No. Passes 3-0. Next item is leave of absences and leave modifications, and we have two of those. Is there any comments by administration on the recommendations?
I have no comments.
Okay, you're looking for a motion?
I would move approval of the leave of absence and leave modifications.
Okay. We have a motion, a second. Is there any further discussion? Hearing none, I'll take a roll call, not a roll call, I'll take a vote. All in favor say aye.
Aye.
Aye. Opposed? No. Passes 3-0. Item D, discussion and action on taxes and fees on employee benefits.
Oops.
No, we have new contracts.
Oh, I'm sorry, I checked it off, skipped right through it. Thank you. New contracts and contract modifications. We have a lot this evening. Of course, it's that time of the year where we're in the hiring mode for the next school year already. Are there any comments from administration on new contracts and contract modifications?
I have no specific comments tonight.
Okay,
Busy.
you have been. This is quite a list. Okay, are there, I'll make a motion to accept the contracts and contract modifications as presented by the administration.
Second.
Seconded by Pat Madden. Any further discussion? Okay, contracts and contract modifications, I guess, and the ones included in the addendum would have been in the motion. Okay, all in favor say aye. Aye. Opposed? None. Passes 3-0. Now we go on to item D. Thank you for that. Skipped right over it. Discussion and action items on taxes and fees on employee benefits. I asked for this to be placed on the agenda for a couple of reasons. One is that this is a new area that I don't think the board has ventured into before, and that would be a tax on employee benefits. My understanding, and I'd like to, Chris, could you introduce our guests just so that we...
Sure. I've asked one of our representatives from the benefit companies, Justin Andalaro, to join me.
Okay.
Beneco, as they're known, has been assisting the school district in all items having to do with insurance. And Justin has a pretty good flavor for what's going on outside of our school district with regard to the topic that you're bringing to the committee tonight.
Okay. And the reason that this kind of caught my attention is because there's a $217,000,
227.
$227,000 new tax that will be levied on the school district of Waukesha because of the Affordable Care Act. And this is kind of new territory for everybody. We don't know all the ramifications, we don't know the reason for it, we don't know if it's increasing, but I'm glad, Justin, that you're here tonight because you're the expert in that area, and that's why we pay you. So I'd like you to, if you could, before we have questions, maybe take us through where we're going to be in 2015 with this tax, why we have the tax, just kind of walk us through what's happening.
Sure. So when we were doing our budgeting for this next plan year, we obviously had to take into consideration the taxes or fees, whatever you want to call them, for the Affordable Care Act. We've got the PCORI fee, which is a $2 per member per month fee for the plan, and then we also have what's called the Transitional Reinsurance and Risk Adjustment fee, which amounts to $63 per member per year.
And if I can interrupt you, the $227,000 is just the transitional reinsurance fee. I did not mention the PCORI fee in the letter. I'm sorry. Right, which would be about
Per year,
another
I'm sorry.
$87,000.
It's $2 per year.
What is a Corey fee?
It's a PCORI fee. It's a patient-centered outcome and research fee. Essentially, it's to fund research for just different outcomes. It's part of the law. It's baked into each health plan, but it's essentially to fund research.
Okay, is that a fee just aimed at our district or overall a national
Correct.
program?
Every health plan will pay this fee.
And so just to ask, the math then is if we divide 227 by 63, we get the number of employees.
It's not just employees, it's
No.
members. So it's spouses, it's retirees, it's dependents. And that's 3,609, and you're going to see it's an odd number because we took a monthly average. So I think it's
Okay, so
3,609 members.
So 36 roughly times 63 would get us to the.
Yes.
Thank you. Sorry.
Great.
Okay, so the transition fee, please explain that to us, what that means.
Sure. So there are these marketplaces or exchanges set up that the federal government or the state government has set up in each state. And the idea is that this fee will help smooth out the losses that the insurance companies expect to take within these marketplaces or exchanges. And so how that's paid is health plans are, and the insurance companies are funding a fund to reimburse the insurance companies for the losses that they expect. That's sort of the gist of it.
Okay, is everybody going to be hit up with this transition fee?
Yes.
Everybody is. So every insurance plan out there is going to be faced with a $65
$63 per year.
Okay,
correct.
$63 per year fee. So it's not just the benefit-rich plans, it's every single plan out there is going to be paying to subsidize the bottom plans where the insurance companies will be losing money? Is that how I'm?
The fee was set up in the case that it happens. And, you know, I guess my professional opinion is that we will likely see that. But that's why the fund is set up. It's only in place for a couple years, and then it's supposed to drop off. The tax that you may be referring to is the Cadillac tax, which is on high-cost plans. And high-cost plans means one of two things. One, it's a rich benefit plan, or it could also mean a plan that has high risk, even with a poor benefit associated with it. So plans that exceed $10,200 for a single, for total cost, and $27,500 for a family plan in 2018. And that will be indexed for some sort of inflation, medical inflation.
But that's 3 years more down the road, isn't it?
That's 3 years down the line. Yep.
Right. And I know our administration is working towards trying to keep us under that Cadillac tax because nobody likes to pay more than their fair share, I guess. It's just human nature.
Exactly. Yep.
Okay. So this tax is eventually going to be phased out
Correct.
in 2018?
The Cadillac tax starts in 2018, but the transitional reinsurance is done in 2016. So there's 3 years of the tax. So we'll make the-
2016,
We'll make the payment for that tax in 2017, I believe, but it's calculated on the 2016 population, if that makes
okay,
sense.
so we'll have the fee for 2015, 16, and 17.
Right, and technically it was 14, 15, and 16 paid in.
Correct.
Yep, exactly.
Okay, so it's 3 years. Okay, now my understanding is that the Affordable Care Act was declared by the Supreme Court to be a tax and not a fee,
Correct,
but yet this is being referred to as a fee.
correct.
Why is that?
That's a great question. I would say we're getting different opinions as to whether or not it's a tax or a fee. Of course, the Supreme Court said that this is a tax. You know, in my opinion, it's semantics. You know, it's paid on an excise tax form, but we're hearing both tax and fee. And
Okay,
so
I believe the language actually in the statute is fee.
the language is fee in the law, but the Supreme Court called it a tax. And so
in the form we're filling out, they're calling it a tax.
they're calling, we use an excise tax form, correct?
Correct. Sounds like the administration's trying to use semantics on this one.
Which administration?
The federal government, the Obama administration?
Well, I just wondered, because we
Yeah.
have many administrations
Yeah,
here.
yeah, no, the federal government, sure,
Yours is an administration.
yeah.
Okay.
Okay. Okay, so the impact that this is going to have on us is $227,000 over 1 year, so $750,000, $800,000, close to that, over the next 3 years.
Mhm,
Okay,
correct.
Plus the $2 fee.
plus the $2 fee. Thank you. And of course, this is an unfunded liability for us. We didn't have a prior source of revenue to cover this bill that we're going to get, and so it's a matter of where the money is going to come from. And so that's why I wanted this discussed tonight, because we have to make a decision. It's a very important decision. Are there any other questions by any other?
Well, it sounds like the finance committee should be on their agenda, not ours.
Well, I did have that
It's a
discussion
budget
with,
matter.
with Joe, and it is a budget matter, but it's also an HR matter. If we decide tonight to recommend to the board that the employees would be liable for this, then it's not an F&F item. And therefore, that's why I had it agendized
Be
for us.
both then, right?
Correct, and depending on how we vote tonight and how the board will vote on this at the next board meeting will depend on if it has to go before F&F or not.
Really? It would go to the board before F&F?
Well, the board should probably make the decision. I mean, we would make a recommendation to the board.
But that's
And-
backwards.
No.
I've never done it that way before.
Well, what would you do?
Well, the same thing you just did, put it on the agenda for finance. And see what both committees do to the board.
But if it's not required to be financed by the district, if it's paid for by the employees, it would need to be in a.
Still
even an
goes through our
agendized-
budget.
Pardon?
It still goes through our budget, still goes through finance,
That's correct.
like all the benefits do.
But what's our recommendation to them?
We don't have one yet.
We don't have one.
Right. That's why I wanted this on the agenda tonight.
I understand that, but I believe it should now, yeah, it should also be on finance
Right.
before it goes to board, because otherwise we're acting backwards and,
Well, and actually, in essence, it is. The finance, F&F has an agenda item for plan design changes.
okay,
And the way we addressed it administratively is we modified the plan in order to absorb the fee and built it into the premiums. So
So in other words, budgetary-wise, you've already dealt with this.
we did
Right.
handle it in a method
Yeah.
all right.
S-
So
but
it
the-
is already built into the premium
that we're proposing along with the plan design changes
that we will,
through, that will be given to F&F on Monday.
Right.
okay,
Okay, but
That
that's
help?
why I asked it to be placed on our agenda, is that this is a policy change, or this is a policy that's being created that the taxpayers are picking up a tax on top of a tax. We're asking to be paid a tax for a tax. I don't even know if that's legal. We don't do that with resale and sales tax.
but if the federal government tells us it's there, what are we gonna do about it?
In my opinion, it's the employee's responsibility. We're paying taxes on employee benefits.
But we pay taxes on a lot of things. I mean, honestly, if we send an employee to a hotel for a conference, those taxes we aren't exempt from. So the district does pay tax. We
But-
pay taxes on our vehicles, when registration on license plates and those types of things.
I understand that, but those are not employee benefits.
No, I'm just saying that it's not precedented that we don't pay taxes.
Okay,
Our Social Security is a benefit to employees that the employer is required to pay the Social Security tax. We pay 7.65% of employee income. And the reality is, the employee is indirectly paying for these taxes either through cost shifting, higher co-pays or premiums for insurance, or they're not getting as high a salary as they might have if we didn't pay any of these taxes at all. I would say that indirectly, employees are taking on some of the burden for the tax, and certainly with the plan design changes that we put into place with the health insurance, I mean, those, we've already done that. So, you know, we're not charging employees to pay the employer portion of the Social Security tax. Also, it's my understanding, Justin, that many CEOs and CFOs in public and private organizations have discussed doing exactly this, but none are willing to step out, be the first to do so. And when we're looking at a very competitive hiring environment, to put our school district out front with this, saying, oh, and you need to pay the $63 a year plus $2 per member per month, so the more people you have in your family, the more you need to pay for this insurance. We'd be the only school district doing that, and that concerns me when it comes to attracting and retaining highly qualified employees. So,
are you saying that every other district does pick up the tab?
yes.
Everybody said that they're going to pick this up.
There isn't another school district that I'm aware of, and Justin, correct me if I'm wrong, but there isn't another organization that your company represents that so far has said, we are going to pass along the taxes for the Affordable Care Act to the employees. Not aware of that.
Okay,
Right, we don't have clients today that are, they've talked about it in frustration. I'll definitely acknowledge that, but nobody's pulled the trigger yet to say, we're gonna pass this along as a line item to our employees.
okay. I'd just like to go back to your comment about Social Security. That's mandated by the federal government. It's a law that we have to pay the half. This one is not a law.
Part of a law.
So it's a law, but it doesn't say we have to pay it.
That's what I'm saying.
That's what you're saying.
Yeah,
Well,
Yeah.
the taxes or the fee or whatever you want to call it is on the plan.
Right.
It's not on the individual, but it's the plan being
Right.
assessed.
but the employee is getting the benefit of the plan, and now the district is being asked to pay the tax.
Okay,
On
this
the
isn't the
benefit.
first, I mean, the Pecori tax went into effect a year ago.
Mhm.
So when we were fully insured, United Healthcare picked up the fee. It was part of the cost of the plan. They did not pass it on to us as a district or to our individual employees.
That's the $2 fee.
Correct. Last year it was $1.
Yeah. Ms. Madden?
I think this is a 2 or 3 year tax. I don't think that any other government entity like the city, the county, the state is going to be assessing their employees for this. And I certainly don't think we should be either. I realize it's a tax, and I realize it's on their personal insurance, but we do provide that as a benefit. And sometimes you just gotta suck it up and say thanks, federal government, or thanks, state government, for shoving another mandate on us that's unfunded. And I do believe this is one of them, and I will not support passing that money on to the employee, especially since we already have it built into our plan.
Okay.
I agree.
I'd just like to make the observation that it's built into the plan. Plan hasn't been approved. It means that it's going to be $227,000 somewhere else in our budget that we're going to be cutting.
Absolutely. I agree with that, but
I don't agree with cuts. I would rather, I don't believe that there's been any discussion by any other governmental group. I haven't heard any of this tax.
then maybe we're jumping the gun.
No, we're facing the bill that's coming. Okay? Had I not asked this to be agendized, it wouldn't have even been discussed. It would have just been put in the budget, and we wouldn't have even discussed it. So,
Can I
okay.
just do a follow-up?
Mhm.
We really do not have a line item budget for this. There is an expenditure because we built it into the changes in the plan. So we are increasing, and I know you haven't seen what's going to F&F, so you don't know this yet. But the proposal is to increase the cost of office visits from $10 to $25 if it's a general practitioner, or $50 per visit if it's a specialist. We've added a fourth tier on the drug plan, so some of those specialty drugs will cost $100 per prescription rather than the normal first tier 2 or 3. So we've built additional costs going on to the members to compensate as part of trying to build in the fee, so we didn't have to increase our premiums.
In other words, what we're doing to save money for the district, which we have been working hard on doing for the last couple of years, is costing our employees more. So, I mean, we're already doing that.
We are definitely shifting some costs to employees in order to absorb this in our premium.
Right.
Are we expected to cover that with those increases? Because we're starting up a new clinic where the office visit's going to be $0. Versus if you go to your own doctor, it'll be $50. So I see people just, instead of going to their own doctor, they're going to be shifting over to the clinic. So
Well, and
are we
honestly,
really
that's
going to
what
have,
we want them to do.
yeah, are we really going to make up the difference with these increases?
Well, if they're not using outside providers, we will more than make up the additional costs. I mean, the savings is there just in not having the office visit charges. So,
Okay,
I don't know if Justin wants to elaborate, if you
Sure.
agree with that statement, and if not, please, you can
Mhm.
certainly correct me.
No, I do agree with that statement. I think that there's going to be substantial cost savings just by shifting those dollars to the clinic as opposed to an office visit or a specialist setting, if that, as that moves forward. So I think Lori's absolutely right there. They are paying part of that cost in their premium share, because part of the COBRA rates that we develop includes the budget items in our health plan, and that's already accounted for to the tune of about 12%. So there's that, then there's the changes that we have on the health plan as well for the year. So those statements are absolutely correct.
okay, this is an action item, so I'd be looking for a motion one way or another.
Why don't you make the motion?
Okay, I'd make a motion that taxes and fees on employee benefits be paid by employees and incorporated into the handbook. Do I have a second? Okay, failing to have a second, I'd be looking for a motion another way.
We don't need the other motion because status quo is status quo. So I
Okay.
don't think we need it.
Okay,
I think you
so,
can just recommend it, move on to the board or whatever
Okay.
you, or finance, whatever you want.
okay. Then I would, I guess, move this non-motion motion forward to the board for consideration.
No, I don't think we can do that. Unless it comes out of committee with approval. It can be part of your report that we considered it, if that's what you wish. As you report as a committee chair to the board, it can be part of your presentation and discussion, but we can't move it forward to the board as an action item because it didn't pass committee.
Okay, but without a motion to do something, we don't have the ability, in my opinion, to actually charge the tax.
Well, if it fails in this committee, but it's on finance, and it's gonna be on the full board, you said, you got 2 other shots at it. So when it comes up for discussion at finance, you can say, it failed in this committee, but you can certainly tell them the discussion we had.
Okay. Or we could have somebody make a recommendation to incorporate, that we pay the tax and incorporate it into the employee handbook. Nobody's
Because I
willing to
don't
do
want them to
that?
pay the tax.
Well, we're talking about seconding the status quo, and if we did that at every meeting, we'd be here all night, every night. I mean, because the status quo is that that's what's gonna happen, right?
Okay.
So if finance wants to disrupt that, then we'll hear from them, but if they don't, then they're essentially approving status quo.
Right.
So,
Well, given that this was a new item, never considered before by the district, I don't know what the status quo is.
well, the status quo is incorporated in the plan going forward, and the finance committee can look at that, and then if they don't like it, we'll hear from them, but. The other thing I would ask, and I know, people have the right to put action items on the agenda, but this came through, and I remember reading my agenda thinking, question mark, question mark, question mark. So, if in the future, any one of us, you or either of us, want to bring forward an action item, I think it behooves us to say why and what the deal is. Because, otherwise you walk in here and you're supposed to, thank you for being here, Justin, and Lori too, and so forth, to fill us in. But otherwise, I just put question mark, what's this all about? So, I think just going forward, we have to do that too.
Okay, I guess make note of that, Chris?
Okay.
Yeah. I actually didn't know that it was even correct, because you're not telling the public what kind of action you're taking.
Well, that's because there's no recommended action. Tonight we were gonna make a decision on the action to take, whether we were going to incorporate taxes and fees on the employees or taxes and fees on the taxpayers. But we came out with no recommendation out of this committee, so we have to go with the administration's recommendation, F&F, that we tax the taxpayers for employee benefits.
As part of the overall health plan that the
Well,
employees are
Yeah,
receiving.
we have apparently no recommendation.
Correct.
Yep.
That's correct.
Okay, so be it. Review and approval of the employee handbook.
Thank you.
Thank you.
Thank you.
Well, I know if we're discussing this, I assume we are.
Yeah.
And this is an action item, I assume, right? Yes.
It is, yes.
It is just taken, I'm sure, and we've all met a couple times, and I know you've put in thousands of hours and everything else, and I was here early, so I could just review it again tonight, and it's just extraordinary. So I really have no problems with it at all, and I assume this will come up for board action.
Correct,
Yeah.
correct.
And the only question actually I had in going back through it, and I don't want to in any way be tedious, because heaven knows we could be here all night, is just this one change, and I don't know what drove it, and where did I write it down? Oh, here it is. It's on page 6. So under immediate family J, part 1J, page 6. Is that pretty typical now in language in terms of employee handbook? Immediate family is defined as husband, wife, children, parents, grandparents, brothers and sisters of the employee or their spouse, as well as persons residing within employee's household. Is that pretty standard?
Well, I'm going to say yes and no. The grandparents were in the support staff contracts, so the old AFSCME contracts, they had grandparents in their immediate family, and the contract that we, from the teachers, did not have that in, and we added grandparents because over the years,
No, I'm fine with grandparents.
yeah. The other part are people, as well as persons residing within the employee's household. More and more often, we have employees that are not getting married, but they regardless have committed relationships. And there's often other family members living in the house, nieces and nephews. We've had that situation right here in our building. We, sometimes due to circumstances that are tragic for children, but, if there's a situation, then that employee needs to care for the children that are not
And
their
I'm
own.
sympathetic.
so.
If it's a life partner of whatever gender, I'm sympathetic.
Right,
If it's, dependents, I'm sympathetic.
Right.
The only reason I ask it is because in the city of Waukesha, and I presume this is true in other cities, and since I live near Carroll College, we run into this all the time. In any single-family home in the city, you can have up to 3 completely unrelated adults living together. So let's say, you have an employee who lives 3 blocks from Carroll College, even has an apartment, doesn't have to be a home, can have 2 buddies living with them,
right.
according to Waukesha zoning code. But I would hate to have them be considered family. So
Immediate
I
family,
just wonder,
right.
and again, I hate to do this, but I just wonder if we could be a little more specific here, like, dependents, something. I mean, because it's sort of wide open there, and just knowing how things are. I mean, we could have a wonderful employee, but he or she has 2 completely unrelated buddies living in the apartment with them, which is fine with the code.
Right.
But then, do we want them to be described as family? So, I don't know. That's the only question I had. Otherwise, I think it looks great.
Yeah, and I think it's a legitimate question, and I don't even know how to respond to
It's
that,
not easy.
because there are people that are in committed relationships that I believe that this clause is getting at, and people, I had the listening sessions, 4 evenings, 1 week in May. We had listening sessions. I included the notes from those
Yeah, I
listening
saw those. That
sessions.
was good.
And they weren't highly attended, but people were appreciative of the opportunity. And this was something that I heard that they were happy to see that was added, that was a suggested addition. I do have some other things that I need feedback from the committee on, but, I mean, certainly I'm open to your discussion on that, adding that particular clause. Yeah,
I think we could leave it in for a year, test it out and see how, if we think it's abusive. As long, and if not, because I understand families today are not families when I grew up.
Yeah, that's true.
And people consider anybody in the house. I know my son just took in a boy that my grandson plays soccer with, who had no place to live. So,
Yeah.
what do you do?
What do you do? I know.
He's now family.
You're right, maybe we should leave it in, and if we suspect it's being abused, then we can try to, it's so hard, it's like, as you say, wordsmithing it in a way, but, if it's a problem, then going forward, we may have to re-wordsmith it, but maybe it won't be.
So that's one we could watch, because we always update this on a regular basis, so.
There is paperwork that we can have employees fill out for domestic partnerships because of the FMLA law that requires that, and, when it's appropriate, we would have somebody fill that out, but, if this is something that we think might be abused, we could revisit that language, or we could just put in domestic partnerships, but again, I don't know, the reception.
No, I'm okay with Beth's idea, let's see.
You're okay with it like this, with
Yeah,
the
I
1
think,
year,
you know,
see how
and
it
watch
is?
it.
Okay.
And if it's abused,
I
then we'll
think
know we have to
one
do
we can
something.
watch.
I would make a motion, since this is an action item, that we approve it, but do we need an action item?
I did promise employees that I would just mention some desires that were made that I didn't necessarily recommend, but I feel that I have to do my due diligence in sharing that with you, so that if you believe that it merits discussion, you can have that discussion.
Are you going through all these little tabs here?
No, I'm not going through all those little tabs,
Okay.
but I didn't know how detailed you were all going to be, so I did tab my changes so I would have a better chance of not missing anything. One of the things had to do with holidays falling during an emergency closing. And I had originally put in that if you are absent on the day before school is closed for snow or cold or something like that, then you would also be charged an absence for the cold day. And employees said, you know what, we get it, if you're absent the day before a holiday, that the holiday would be an absence as well, or not paid. But we don't get it, why, if you're absent the day before an emergency closing day, why you would automatically be charged a sick day for that closing day too.
Right.
And I kind of felt like, yeah, I get that. The holiday is something that's planned in advance, and people know about it, but people don't always know about the emergency closing day. And it's not like they're planning to be absent the day before a holiday. What we have are people saying, could I please take a personal day or a deduct day on the day before a holiday? And they're using it as a travel day. And so what we're saying is, if you're not there the day before the holiday, then you're not going to be paid for that holiday. And that's to try to get at people's attendance. But the emergency closing day, I thought, well, okay, I guess I get that. If you're sick before the emergency closing day, you're not necessarily going to be charged a sick day. Unless you're on FMLA, a long-term leave, we've always charged the sick day for that. So.
But
any-
that's specified in that part of the law, right?
It's not specified in that part of the law, but
So we'd
it's-
have to pay them too?
they would be charged their sick day for that day, or it would be an unpaid day regardless if they didn't have sick days left. But when people are on FMLA and then we close school because of an emergency, we always get calls from people saying, hey, nobody else got charged a day, you know, they didn't have to go to work, so I don't want to be charged a sick day. And we're like, you were gonna be working, that was a work day, and you get charged it. And we always, we've done this like way before I got here. I think it's always been really consistent that way. So if you're using sick leave and you're on FMLA, you're using sick leave on that emergency closing day too. So, so anyway, that holiday was the, for the emergency closing day was one area that I guess I did recommend it, and I would have made those changes. You have to make some policy changes, that goes to another committee, and then we can change the handbook. Just because of the way some language was written in the policies that just didn't make sense anymore. You're gonna go through all those tabs, I guess. I'm just paging through them, Ellen. Nope, that's a good one. Okay. In the Part 3, non-exempt hourly staff positions on page 58. I met with some people about pay rate for overtime, so D, it's about halfway through the page. Do you see where I'm at?
Yes.
Right now, if an employee, a full-time employee, is, say we have our holiday on a Monday, and then they work Tuesday through Friday, they've got their 40 hours in, and they're called to work on a Saturday, this would be like a custodian. Those Saturday hours would be straight time. They've asked again for holiday, for that holiday to be counted as part of their 40 hours. Now, that's not required under the Fair Labor Standards Act, and so we were not counting the holiday. In fact, we were not counting the vacation day either. But, you know, because we knew that employees were just really, and they felt like, boy, I'm taking a day vacation, and then I get called in to plow on a Saturday, and I don't even get overtime, or I get called in because of an emergency for an hour, and I have to drive a half hour to work and a half hour home, and I get an hour, and it's only straight time because I happen to use a vacation day, you know, and half my Saturday's gone. You know, so as as an olive branch, we said, okay, if you're on vacation, we'll count vacation hours towards your work hours and pay overtime if you have to be called in for additional time. And it came back saying, but we also want the holiday to count too. Quite frankly, administration was not in favor of that. We felt like if you're getting paid for your holiday, whether you work a holiday or not, you're getting paid. If you have to work on a holiday, you're getting paid for working on that holiday, and you're getting paid for a holiday too. So counting a holiday towards overtime didn't sit well with us, but I said that nevertheless, I would share that sentiment with the committee. Are you following me?
I'm
Okay.
following you.
So
Okay.
they're getting paid double time to work on a holiday?
Yes, they used to get paid triple time. They would get paid double time for working a holiday, and then they would get paid for their holiday.
Oh.
So, in this scenario, they would just be getting paid straight time for the holiday, and then they probably wouldn't accumulate any overtime that week if they had to work an additional day that week. So,
Well, I agree with you. I don't think we should be paying them for the holiday. They're already getting paid, so that shouldn't be included.
Sounds reasonable to me. So it's as stands here.
as it stands, and what I put in, italics there is time over 40 hours per week does include vacation time, so we're giving the employee that, so they're getting paid for their day off, their vacation time, and then if they get called in on a Saturday or something, that vacation hours would count, and I felt that that was a generous move. Right now, that is not in place. The way I have it with vacation is not in place, so the vacation pay does not count towards their time worked. And that started July 1st, 2013, when the contract ended.
What happens when an employee works a 10-hour day and come Friday, they've got their 40 hours in at noon or whatever? We send them home at that point?
No, if an employee is working 10-hour days, then the expectation is that employee has received prior approval to work those extra hours from the supervisor, and that there's overtime available or comp time available to pay that employee that extra time. So we wouldn't, the assumption is that we need that employee the full day on that Friday. We wouldn't send someone home early.
But it says we don't pay overtime until you hit 40 hours.
Correct, yes.
So,
We could send that person home at the end of 40 hours at
Right.
noon on Friday, but then you don't have that person the rest of the day on Friday.
I guess that's my point, is that an employee, if they have to stay longer in the day, custodian or whatever, and, overtime wasn't approved, or, we're saying that overtime is not being paid until you hit your 40 hours.
Correct.
So if they work a 10-hour day, 2 days out of the week, that's 4 hours.
Right,
So come Friday, they won't be eligible to work past 40 hours without getting paid.
It is not our practice to shorten
Time
their
and a half.
work week to accommodate a day where they had additional hours. So.
What's the practice? What do we do?
In your scenario, they would have 4 hours of overtime if they worked 2 10-hour days.
with permission.
Okay.
I mean, they would have to,
So they're required to be here 8 hours a day no matter what,
a full-time
If they're
employee.
full-time.
if they're
people,
full-time?
yes.
Okay, all right. Because then this doesn't make sense to me.
It does not?
No, it doesn't make sense to put in, you have to be here 40 hours a week to get overtime. If we're going to require them to be here 8 hours anyway, and if somebody has to work overtime because it's 10 hours, you don't know when you're going to get your 40 hours in. In other words, if you work 10 hours on Monday, I don't know if you follow what I'm saying or not. It doesn't, if you're not, 40 hours is 8 hours a day. So if you work on Monday 10 hours, you're actually going to hit your 40 hours before your 8-hour shift is up on Friday.
So According to the Fair Labor Standards Act, we are required to pay time and a half when an employee works more than 40 hours in a week. So if you work 10 hours on Monday, that doesn't incur overtime because you haven't worked your 40 hours yet. You would only work your 40 hours, once you've accumulated 40 hours, and anything after that would require the overtime payment. So, a person could arrange with their supervisor to work, 4/10s and take Friday off. That's something that's doable. It doesn't incur overtime. What I'm saying is we would not allow someone to work more than 8 hours a day if we expect them to work full days all week, unless there was some circumstance that would require that. Now, just given the example of snow plowing, you could have a maintenance worker work 8 hours a day, Monday through Friday, and Saturday we have a snowstorm and he or she has to come in and plow. Those are all overtime hours. If they came in the middle of the night on Monday night and worked, and then they worked their regular shift, by the end of that week, they've accumulated their 40 hours and then some. And then some would be overtime. So it's not more than 8 hours in a day, it's more than 40 hours in a week.
Correct. But Lori just said we can't send them home early on a Friday.
It hasn't been our practice to do that, but we can legally.
This doesn't preclude us. So if they had authorization to work the overtime in any given day, we would pay out their overtime.
But we're not allowed to pay their overtime until they hit 40 hours, according to this.
So when we only pay twice a month. So
Okay.
that 40-hour week those extra hours would be included on their next paycheck.
Right.
Okay.
So that goes. That's the way you have it in here.
That's the way I have it in there.
Okay,
is
well.
with-
No,
Yeah.
I just wanted to make sure because 40 hours a week and 8 hours a day,
Yeah, it's not the per-day number of hours that trigger it, it's the 7-day period
Right.
work week.
okay. But I just want to make this clear. We're requiring, because you said one thing and you said another. You said somebody who can negotiate with their boss to work 4/10s. You're saying we have to be here 5 days a week, 8 hours a day.
If that's what their schedule is, and custodians, at this point, we do not schedule, I'm assuming we're talking about custodians, but right at this point, I don't have anybody scheduled to work a modified week. So it's a 5-day week.
Okay.
She was explaining to you our practice. I was
Right.
just giving you what's legal.
Yeah. I'm trying to avoid conflicts with employees.
I try to do that too.
Yeah, so it is not our practice to send them home.
What if they want to go home?
They have the ability to take comp time. That typically they typically have comp time banked.
Okay. Once they get their 40 hours in, they could go home early Friday, but you can't because you're a custodian at a school. So then
If
we're,
there's an event where you have to be there to lock your building per se.
okay.
Then
So then we have to pay them overtime no matter what.
or they're allowed to bank it at time and a half. They are allowed to accumulate comp time.
Okay. Okay.
I have another item on page 60, vacation entitlement. This was a change that the board approved last July. And what it said last July was we will limit vacation for support staff to 4 weeks, and we will create a schedule. So this is a schedule that is created, that's in the handbook for the first time. The whole non-exempt hourly staff provisions are for the first time. And what we've done here is, in your first year of employment, you would receive 1 week paid vacation. So if you started July 1st, then you'd have your 1 week paid vacation. If you started before July 1st, for instance, say you started January 1st, you would receive a prorated amount of 1 week vacation. But on July 1st, that is still your first year of employment, so you would still receive only 1 week vacation to use from July 1st to June 30th. Following me?
Why are we going through this? Is there some issue with this?
Yes, the reason we're going through this is because I've received feedback from employees, some employees that have said, if I started in December, why can't I, July 1st really be, it's the second fiscal year that I'm here, even though I've only worked 6 months, and could we start out with 2 weeks vacation? And I said that I would bring this to the committee's attention, and because some people, when they come to work for us, they're leaving like 2, 3, 4 weeks vacation on the table from wherever they've come. And so that has been asked. I am,
I think that happens all the time, and I like it just the way it is.
Yeah, that's very reasonable.
all right, thank you.
Very reasonable.
I think that is all of the points I wanted to make. All of the rest of the points were made on the listening session feedback. Things that I thought should be incorporated were, and they were redlined for you, so I am finished unless you have any other questions.
So now I ask, do you need an action? All right, I
Yes.
would move that we approve this employee handbook as revised in our copy, and that will then go forward to the board.
Second.
Okay, we have a motion on the floor. All in favor, say aye.
Aye.
Aye. Opposed, 0.
Thank you.
Okay. Last item on our agenda this evening is approval of the recommended candidate for the position of principal of Hatfield Elementary School.
He looks very good. You know him already, so obviously you know. I recommend I move approval of this appointment.
Second.
Okay, motion to the approval of the recommended candidate position of principal of Hatfield. Chris, do you have anything you'd like to add?
I would just add that the hiring team is excited about this candidate. I think it's okay for me to say the name now, right? Yeah. That's a confidential copy, I think, so it's Robert Blessington. He's an assistant principal at North High School, and he's been doing a great job at North under the guidance of Jody Landish, and he's applied for this position and has had some background with a diverse population of students and at the elementary level, and he was unanimously approved by the selection committee there, so they're pretty excited.
Yep. It's always nice when we can promote from within, because we know the quantity and the commodity that we're getting for the money. And Mr. Blessington has made, I think, a very favorable impression on the board in his tenure with us. So I guess, let's see, we had a motion? Seconded? All in favor, say aye.
Aye.
Aye. Those opposed, 0. Thank you. And that would conclude our meeting for this evening. Thank you for watching. Have a great evening.
Thank you.